Hello everyone, I hope you are doing good. A very happy new year to all of you. Let's take a PYQ topic. Which of the following drugs should never be used in pregnancy? Right. So basically they are asking here us the teratogens. What are teratogens? Anything which on exposure to pregnant lady affects the fetus. It causes fetal defects or fetal anomalies is known as teratogens. Right. So now this topic is very important. As being doctor, we should never prescribe the teratogen drug, right? The most toxic of all the teratogens, there is a list of teratogenic drugs, but the most toxic of all the teratogens is the cytotoxic drug or the anti-cancer drug. As you all know that anti-cancer drugs, they inhibit the cell division. So they will inhibit the fetal growth also. Right. So these drugs, they are inhibited in all the period of gestation. Whatever period of gestation it is, they will be inhibited. Right. And they will also be inhibited even in the lactation. So they are also inhibited even in the lactation. Right. So one thing is clear to you that no cancer can be treated in the pregnancy. Right. No cancer can be treated in the pregnancy, and the lactation is contraindicated if the patient is on the cytotoxic drugs. Okay. Now let's see the question. This was a tricky question rather than a difficult question. Which of the following should never be used in pregnancy? So you know that mifepristone is anti-progesterone. So when we will give anti-progesterone to the patient, the fetus will expire, right? Because progesterone is must for the fetal growth. Okay, so mifepristone is anti-progesterone and the fetus will expire. So of course it will be contraindicated into the pregnant lady. Misoprostol. Misoprostol is prostaglandin E1, and prostaglandin E1, it contracts the myometrium. So because the fetus is in the uterus, if the myometrium will contract, then the os will open and the fetus will expel out, right? So again, this is also contraindicated. Let's take the third drug, methotrexate. Methotrexate is cytotoxic, right? And dinoprostone, it is prostaglandin E2. Again, it will contract the myometrium and it will expel the fetus. Okay, so out of all these all are teratogens. Out of all these, the most cytotoxic drug or the most teratogenic drug is the methotrexate. So that becomes our answer. Okay, so the most toxic drug is the methotrexate, and that becomes our answer, right? So before coming to a conclusion, before coming to an answer, it's a request, please read all the 4 options, okay? Because our question is choose the best, right? Now let's see what is Mobius syndrome. Let's say that the patient has taken the misoprost, and the myometrium contraction happens, but the fetus didn't expel out and the pregnancy continued. Okay, now in that case, the fetus born to the mother who has taken the misoprost will have the Mobius syndrome, which is basically 6th nerve, 7th nerve, which is basically 6th, 7th nerve palsy, right? Here most of you get confused that whether it is mifepristone or it is misoprostone. So it is misoprost. Here we remember this thing that in the misoprost there is 2S. Okay, in the misoprost there is 2S, and in the Mobius also there is 2S. Mobius syndrome 2S, and misoprost also has 2S. So don't get confused that mifepristone is causing the Mobius syndrome, right? Now let's see which of the following is contraindicated in psychiatric disorder in pregnancy. So psychiatric disorders drugs, they are very teratogenic drugs, okay? But the most teratogenic is always the cytotoxic drug. Now let's see what are the options. Let's read them. Lithium, valproate, carbamazepine, levetiracetam. So all these 3 are the teratogenic drugs. All these 3 are the teratogenic drugs, but out of all these, the most teratogenic is valproate. The most teratogenic is valproate. So the answer is teratogenic. Let's see why the anti-epileptic drugs, they are teratogenic. Okay, why these anti-epileptic drugs, they become teratogen? Okay, the anti-epileptic drugs, they interfere with folic acid metabolism, and the folic acid is must for the neural tube closure in the fetus. Okay, so because they interfere with the folic acid metabolism, so they cause the neural tube defects. Right. Now, out of all the anti-epileptic drug, the most toxic is valproate. What I mean to say by when I am saying that most toxic is valproate, I mean to say that if 100 women are taking the valproate, and if 100 women are taking the carbamazepine, and if 100 women are taking the lithium, and if 100 women are taking the phenytoin, okay, so then the maximum neural tube defects will be seen in the fetus whose mother were on valproate. Okay, so maximum neural tube defects will be seen in the fetus whose mother were on valproate. Okay, so that I mean to say that when I am saying that valproate is most toxic of all the anti-epileptics, right? Is there any anti-epileptic which we can give to a patient of epilepsy in pregnancy? Yes. Is there any anti-epileptic which does not interfere with folic acid metabolism? Yes. Rather than one, there are two. So they are levetiracetam and the lamotrigine. So the two drugs are levetiracetam and the lamotrigine. Out of this, the levetiracetam is preferred rather than lamotrigine, because lamotrigine has a high drug clearance and it also causes the Sjogren syndrome. Right. So now a last and quick note on the drugs contraindicated in lactation. As already discussed, cytotoxic drugs, they are contraindicated in lactation. Another drug which is contraindicated in lactation is the lithium, and that is what we get a question on the INI set in the recent exam. Okay, what was that question, that how we will taper, what we will do to the lithium in the third trimester. Let's say the patient was on lithium and the patient has come in the third trimester. Now we will decrease the dose. Okay, the dose of the lithium is decreased in the third trimester as it is teratogenic in lactation. Okay, so the answer was decrease the dose of the lithium in the third trimester. Okay, decrease the dose of the lithium in the third trimester because the mother, because in lactation the lithium is teratogenic. So only two drugs are contraindicated in lactation. Number one is cytotoxic drugs and number two is lithium. So lithium causes the Epstein anomaly. Lithium causes the Epstein anomaly, right? And it is basically the shifting of the atrioventricular valve. Okay, thank you. I hope you like this information. For more such informations, do subscribe my channel, like it and share it with all your colleagues. Have a nice day.